Good afternoon and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm ASHLEIGH, MESSERVY. Joining us today, we have Dr. Kerry Solomon. We're here at Carolina Eyecare Physicians. Thanks for having us today.
Thank you for having me.
All right, so before we get into all of your expertise and all of the things that you've been doing here at Carolina Eyecare Physicians, tell us about your practice here.
Yeah, so my practice really specializes in cataract and LASIK surgery. I've been in the Charleston area for about 30 years and just very fortunate to have built the practice that I have.
And so why did you decide to get in this area of medicine?
You know, ophthalmology is terrific. Cataract surgery and LASIK surgery in particular are two areas where you can have a huge impact on someone's quality of life. I can take someone who's struggling to see things or see the world clearly and allow them to not only restore their vision and get back to what they want to do, but allow them in many ways to see better than they ever have. And at the end of the day, it's about improving someone's quality of life.
And technology has made it now more than ever better to do that, right?
Technology has changed like I could never have imagined. I couldn't have imagined 5 years ago where we'd be today. And I've been doing this for 30 years. Part of the reason I got into this was because ophthalmology and cataract and LASIK surgery are changing so fast that it's really fun to be involved in, especially on the cutting edge things.
And so let's talk about the cutting edge. I mean, you're going all around the country and things like that to do lectures. What are some of the things that we can get excited about when it comes to this area?
Well, I've been in a position, very fortunate position, where I travel all over the world. I have a chance to look at new startup technologies and get involved with cutting edge research. We're doing procedures now where with new intraocular lens implants, I can provide people not only clear vision in the distance, but we can give them distance and near vision. We can give them distance, near, and intermediate vision, things we couldn't have done years ago.
That would have just been with glasses? You would have just worn glasses
Correct,
instead of
after
doing
cataract
that, right?
surgery. When I first started this, people wore glasses after cataract surgery. Now, most of our patients are not wearing glasses, certainly those that choose.
So when you have a patient come in, are they surprised when you tell them that that's a possibility? Or do you find that most
people are pretty
don't
well
know
read.
that?
They look at the internet, they read up on a lot of this.
That can be dangerous too,
And
though.
I used to be able to predict who would be interested in this, and I had one woman many years ago. She was 82, I will never forget, and she told me I have better things to do with my day than worry where I left my last pair of glasses. So we provide the best education we can to everyone so they can make a good informed decision, but the truth is most patients today don't want to be dependent on glasses.
I mean, it can be, obviously with the fashions today, they're fun, but at the end of the day, having better vision is always a good thing, right?
And you take for granted, you know, I want to watch TV, I want to drive my car, but at the same time, I want to answer my emails, I want to look at my cell phone, my watch.
Multitasking and everything.
And so we do a lot with our vision. It's great. We have the tools to be able to restore it. We even have lens implants today that will change shape after surgery. These are called light adjustable lenses. There's only a handful of us doing this in the country where we'll do the surgery and then afterwards we can titrate and adjust the lens with light to a patient's unique prescription. And we can also give people a chance to test drive their vision. I want to try something called monovision, one eye for near, one eye for far. Can I move this one a little closer? Can I dial this one a little more? We can adjust it up to 3 times just with light, and then we lock it in and they're good to go again, just with light. Very safe and very non-invasive.
Okay, I have to ask this question. So like, let's say there was a military person who wanted to fly jets or something, and their vision was not exactly what it needs to be. You could actually change their life and impact it where it could be.
We do that all the time.
Are you serious?
And we do that, especially in the military, folks, with LASIK eye surgery. And we're treating things today with LASIK beyond glasses and contact lenses. We're treating people today in a way that we're aiming. People say, are we shooting for 2020? Is that the goal? And it's always the goal. But more times than not, people are seeing better than 2020. Most people say they see better than they've ever seen with their glasses and contact lenses, which is not a surprise because we're treating things beyond glasses and contact lenses.
So that means you're treating, people from all walks of life and different ages, right? Because a lot of times people associate cataract surgery with older people.
Well, yes, but I'm really referring now to LASIK surgery.
Yes, but with LASIK.
And so with LASIK surgery, we tend to, the sweet spot for LASIK is when your vision stabilizes, but typically 18 to 20 years of age, on up to about 35 to 45, even 50 years of age before you get into reading glasses. When you get into reading glasses, then we talk about lens replacement surgery. More and more people are choosing to have their lenses removed and replaced to be less dependent on glasses before they get cataracts, and then they'll never actually develop cataracts. And then later in life, we deal with cataract surgery. So from a vision standpoint, and I'm very fortunate because all I do is eye surgery, we can manage people's visual needs from age 18 on up with a variety of technologies.
Okay, obviously we're still in the midst of all the COVID and situations, and everyone's taking all these precautions. We're socially distancing here, so that's why we don't have our mask on. But what are some of the precautions you're taking here?
So we've been busy from day one through this entire pandemic, and we have taken the highest level of precautions. With histories, we check temperatures. Everyone in the office, including myself, are masked. We have plexiglass barriers. We sanitize every room and every diagnostic station. Very, very, very safe, and I'm very pleased to say that we've had no incidences of infections in the office. It's safe, it's effective. If folks are bothered by their vision, interested in cataract or LASIK surgery, come on in. There's never been a better time.
I could talk to you all day about this because I'm just thinking of all these different questions, but I won't ask all of them. But before I go, as far as like recovery time these days, are they recovering faster than they have?
Amazing. When I first got into this business, we were still admitting people to the hospital, and we would watch them closely for 5 to 7 days, and we would wait to prescribe glasses for 4 to 6 weeks. Today, we don't prescribe glasses. Most people want to get out of glasses, and the beauty of today's surgeries, most people are back to what they want to do the same day or the next day.
Really? So they're not walking around with a bunch of patches on their eyes and stuff?
No, not in 2021. Not at all.
Alrighty, well, thank you again for having us today. And for more information, of course, you can head online to drkerrysolomon.com.